What's up guys, Lateral Lifts here. In today's video, we're going to cover some basic biomechanical terms to help you better understand workout programs. Biomechanics is the study of mechanical law relating to the movement or structure of a living organism. Now I know that sounded like a mouthful, but don't worry, Lateral Lifts is here to help you out. We're going to take it one step at a time so it's nice and easy to understand. Concentric contraction. A contraction in which a muscle is shortened. It is sometimes referred to as the positive portion of a lift. When you're performing a bicep curl, it is the actual lifting portion of the exercise. Eccentric contraction. A contraction in which a muscle is lengthened under a load. This is often referred to as the negative portion of an exercise. When performing a bicep curl, the lowering of the weight is what is known as the eccentric contraction. Isometric contraction. A contraction in which a muscle is activated, but rather than lengthening or shortening, it remains the same length throughout the entire movement. A plank would be an example of an isometric contraction, as you're engaging the muscles of the core, but they remain the same length throughout the entire exercise. Flexion. A movement that decreases the angle at a joint. A hamstring curl is an example of flexion at the knee joint. The angle becomes smaller as you bend your leg at the knee. Extension. A movement that increases the angle at a joint. A leg extension, just as the name implies, is an example of extension at the knee. As you straighten out your leg, the angle at the knee becomes larger. Supination. A term that describes the orientation of your foot or hand. If your palms are facing towards you during a dumbbell bicep curl, then your hands are supinated. Pronation. A term that also describes the orientation of your hand or foot. If your palms are facing away from you during a dumbbell bicep curl, then your hands are pronated. Midline. An imaginary line that runs vertically across the body, separating into both right and left sides. Adduction. Adduction occurs when moving a body part closer to the midline of your body. During a dumbbell lateral raise, adduction is occurring as you bring your arms closer to the midline of your body. Abduction. Abduction occurs when you move a body part further away from the midline of your body. When performing a dumbbell lateral raise, abduction is occurring as you move your arms away from the midline. Medial rotation. Also known as internal rotation, medial rotation is a rotational movement towards the midline of your body. When using a resistance band to rotate the shoulder towards your body, medial rotation is occurring. Lateral rotation. Also known as external rotation, lateral rotation is a rotational movement away from the midline of the body. When using a resistance band to rotate the shoulder away from the midline, lateral rotation is occurring. And that's going to wrap it up for this video. With these terms under your belt, you'll be able to understand basic biomechanics and be better at reading exercise programs. As always, make sure to like, comment, and subscribe. This is Lateral Lifts signing out. Have a good one, guys.